Okay. Good evening and welcome to the 32nd meeting of our Alameda County COVID-19 Community Advisory Group. This meeting is interpreted live in Spanish, and you can select the globe or the dots on your screen in order to participate. In English or Spanish, we encourage everyone to select the language in which they plan to participate. Could I ask one of our colleagues, Maria or Guillermo, to make that announcement, please?
Of course. Buenas noches, bienvenidos a la junta del grupo de consejería de la comunidad. Como ustedes saben, esta reunión se transmite con interpretación instantánea para español, para inglés. Para poder participar completamente de la junta, por favor, denle clic al globito que está en la parte baja de su pantalla y escojan el lenguaje que quieran, en inglés o español. Gracias. Thank you.
Thank you. I will start that now. Wonderful. And the other items are that we have closed captioning available. If you'd like to select that, you can click at the bottom of your screen or top. And also reminding people to please speak slowly, and if you can speak slowly and read slides that you're presenting so that our interpreters in Spanish and our interpreters in American Sign Language can keep up and interpret. As always, please ask questions in the chat and mute your microphone when you are not speaking. And with that, I will turn it over to one of our co-chairs, Greg Hodge.
Cool. Thanks, Lauren. Good afternoon, everybody. Hope you are doing well and thriving on this great Tuesday. Thanks for joining us again for this meeting on behalf of Kimmy Watkins-Tart and Nestor Castillo, who can't be with us tonight. I want to welcome you to this meeting of the Community Advisory Group. As always, we start with an acknowledgement.
That's Siri.
Somebody needs to mute, I think. We always just start with an acknowledgement of our Native American relatives, our neighbors who are from the Ohlone community, the folks who are occupying this land well before most of the rest of our ancestors got here. And we just want to acknowledge them, acknowledge their land, acknowledge the displacement that they've experienced as Native Americans. We also just want to take a moment to acknowledge the fact that it's African American History Month. There's a month filled with lots of activities to learn more about the African American experience. And one of the people, the person who started this celebration in 1926 was Carter G. Woodson. And Woodson grew up to be an academic. He was a working class kid. His parents were formerly enslaved folks. He was born in 1875. And so he was in that generation of folks who came through the period of chattel slavery and through the Civil War and all of that turn of the century activity here in the United States. He attended high school in West Virginia, where he grew up when he was 20 years old. He was not able to attend high school until then because he worked in the coal mines in West Virginia to support his family. But then he went from there to Berea College in Kentucky. He was received his master's in education, I believe, from University of Chicago, and then went to Harvard, where he received his PhD. He was the second African-American to get his PhD, and the first was W.B. Du Bois. And so Woodson started Negro History Week, and he put it between the birthdays of Frederick Douglass and Abraham Lincoln so that people would understand more about our history and culture, all people, not just African-Americans, but that everyone should kind of understand the history and culture and experience. And I find it interesting that, you know, we were going through all these debates about critical race theory and whether the curriculum should be taught in Florida and other places. And Woodson started with the idea that we should learn all of our histories, no matter the race, religion, national bias, et cetera. So today, what's become African American History Month started as a week. We want to celebrate all of those people that have contributed to the history of the country, including Black folks. And I need to slow down in my talking so that I can then stretch this out a little bit, right? All right. So with that, we want to make sure that everybody is welcomed. We want to ask Joan Edelstein, who's one of our partners, to talk about school nurses. And so, Joan, you can take about 10 minutes, including questions and answers that people have, and then we'll go to any other updates from our community partners. So, Joan, please.
Thank you. May I have permission to share my screen?
Do you, is it stopping you right now, Joan?
Let me check it. Yes.
It is.
Yes.
Okay. Okay. Let me,
Now I can do it. I'm good.
Great.
Thank you. Just take me a second. And I'm actually going to skip through some of these slides because it's a bit dense, but I include the additional information because I want to make the PowerPoint available. So afterwards, any information that's needed will be available to everyone. So the first thing I wanted to do is to explain a little bit about school nursing, not because I assume that people don't know what school nurses are, but when we speak with any nurses, registered nurses in general, they often think that school nursing is not real nursing, that it's just putting on Band-Aids and doing first aid. So the first thing I want to do is just to be really clear about what school nurses do and who they are in California and Alameda County. And these are some of the roles, just some of the roles that school nurses have. More importantly, I think looking at the school nurse role as the person who is caring for the pediatric public health population. So school nurses are public health nurses for the pediatric population. So just looking at Alameda County students in TK to 12, we have well over 214,000 students with 10% or more having asthma and current symptoms. Having been asthma, I started out as asthma nurse at USD in 2003 on a CDC grant. And some of the schools, we had over 25% of students with asthma, a diagnosis of asthma and current symptoms. 8% of our students we would expect to have food allergies. There may be an overlap between those two. Problems with dental caries, seizures, other chronic conditions. And of course, the school nurses are responsible for immunizations. And I want to mention here that the school nurses are the only health professional in the schools. You may be, I'm sure, I don't even say you may be, I know that you're familiar with school-based health centers, but they are actually contracted with the schools from an outside agency. And so their staff are not part of the school district. They're contracted with the school district. So one of the things a school nurse does, if there's a school-based health center, is link the two. Again, we're back to the pediatric public health population, primary, secondary, tertiary prevention. The school nurses are responsible for keeping our students immunized and up to date, working with families, doing the vision and hearing screening. And more importantly, and one of the reasons I wanted to speak today is collaborating with community healthcare agencies and healthcare providers. And these just kind of the coordination that the school nurse does. And school nurses are health educators. And they're also mental health providers. Very often, the first person who identifies a mental health issue will be the school nurse. And we're very fortunate in Alameda County that almost all of our districts have school nurses. And Oakland is the only one that has a ratio where you should not have more than 1,250 students for each school nurse, according to their contract. We support student attendance. Research shows for a very, very long time, since the beginning of school nursing in 1902, that one of the main reasons we have school nurses is to support attendance. And we also support health equity and are very concerned about health disparities. We talk about social determinants of health. For example, as far as disparities, we when we were talking about vaccinations, particularly on COVID, when we talk about vaccine hesitancy, it's not just about people who are vaccine hesitant, but what are the barriers to people getting vaccinated? So I want to move quickly to the pandemic, which is why I'm here and why I'm sharing the information. So one of the issues that came up during the pandemic, amongst many, is that school nurses were basically excluded at the state level from any planning or implementation by the superintendent of public instruction. When the announcement was first made that there would be planning and we will get on top of things in school for the pandemic, a list of the team members that would be included did not include school nurses. And in spite of repeated requests from the California School Nurses Organization, the school nurses were ignored. And finally, Samantha Blackburn, who many of you know, used to be at Oakland Unified and was in the school health centers and is now at Sac State in the credential, teaching and coordinating the credential program. And I wrote a letter to the superintendent of public instruction, and the Alameda County school nurses wrote a letter supporting that, saying, you really need to include school nurses. And finally, there was an apology to the leadership at CSNO, but they were still never included. And so that was a problem in terms of role model to districts. We've never had a school nurse consultant at the County Office of Education. So in the county itself, there's not a focus on school nurses. So there was a variety of responses. There were some districts that turned to school nurses, some that excluded them. Some districts actually tried to direct school nurse practice. I will give a quick example of one superintendent who told the school nurses that if a student came to the office with symptoms that might be COVID, that the school nurses were to determine whether they were COVID-related symptoms or could be from something else, and they could stay in school. And the school nurses said, this is beyond our scope of practice. Alameda County Public Health Department has guidelines that we have to follow. And the superintendent said, those are just recommendations and the health department doesn't make policy. Fortunately, the health department worked with me to intervene and that didn't happen, but it's an ongoing problem. And that's one of the reasons that I advocated to be invited to join this group, and have very much appreciated being able to bring all the information back to the school nurses. And finally decided at this point that I just needed to put an emphasis and focus on school nurses. I want to be careful of the time. Just to let you know that the school nurses have been meeting monthly since 2007 during the diabetes lawsuit. Brenda Yamashita at the health department started that. About 10 to 20 of us would attend every month. By the time the pandemic started, we could not meet in person. So I shared my Zoom account and started hosting meetings strictly for school nurses and no one else. By April of 2021, in our weekly meetings, we were having 60 of the school nurses on average on the Zoom calls, sharing information, trying to maintain some continuity. We had representatives from the health department and the County Office of Education, and continued to meet once a week until last fall. We now have generally 30 to 40 nurses on the Zoom calls that are twice a month, although we have over 100 nurses that share information on an ongoing basis through email and Zoom. And the Alameda County Office of Education hosts from Zoom. And we have many representatives from community agencies. These are some of the things that the school nurses did during the pandemic. I think I repeated myself here. We've done many policy changes. For example, here are the districts that have policies so students can access naloxone, as an example. Oakland also now has a policy allowing access to medical cannabis. So what I would like to do is wrap up first with an invitation for any of you, any of the agencies, yourselves as practitioners, to come to one of our school nurse meetings. They're the second and fourth Wednesday at 2 o'clock, to share what your agency is doing and how the districts can partner with your agencies, or what the school nurses can help with in terms of meeting your agency's goals. And that's my contact information. And let me unshare my screen in case you have any questions whatsoever.
Oh, Joan, thank you so much. Any questions? Anybody? All right, hearing none, thank you, John, so much, and definitely share your deck with everybody, so we make sure we have that information. Thank you.
Thank you. Thank you for allowing me the time. And I also just need to say I have a 6 o'clock class, so I'm going to be leaving early. Please don't be offended.
Okay,
I appreciate it.
We won't. We're glad you made time. Thanks, John. All right. This next now, any updates from any of our other partners? Any folks that want to share anything that's going on before we go to the county updates? All right. Let me turn this over to Kimmy Watkins-Tart, our fearless director of the Public Health Department. Anything you want to say to kick this off in terms of what Nick and Donato are going to do today?
Thank you, Greg, and thanks again, Joan, for sharing with us the important role and reminding us the important role that school nurses play as part of our public health system. So just want to, usually in these meetings, we provide an update on where we are with the pandemic, where we are with the numbers, what's going on in the community. That's usually provided by both Dr. Moss and Dr. Nielsen, and they will both be sharing similar information tonight, except tonight, Dr. Moss will talk a little bit more, actually a lot more, about the emergency declarations that we all been hearing about ending, and sharing a bit more about, as things decline, as the responses start to decline, what that means, what we know, what we don't know. Donato will share some information about how our response is changing and how we will continue to monitor COVID activities despite policy changes, despite other things that are going on. There are still lots of COVID activities that will be happening in Alameda County. So Donato will share a little bit about that. So I will turn it over to Dr. Moss, our county health officer.
Thanks, Director Watkins-Tart. Good evening now, everyone. Nice to see you. We'll jump right in. Next slide, please. Okay, so just a sort of a brief where we are. Cases have been declining for about 2 months. Case reports, although things have flattened out in the last, I'd say, week or two. Still just under 100 people in the hospital. Wastewater signals mixed. Actually, our the main source that we look at is showing an increase. I'll show you that in a minute. But we remain much lower in terms of all of our metrics than we were back in December, and we remain at low COVID-19 community levels. And we really do seem to be beyond all the flu and RSV that we were dealing with earlier this winter. And I think it's also just important to note that we are in a much better situation than we were in the prior 2 winters in terms of just the sheer impact of number of cases and severe illness. And I know there's much more home testing now than there was during those earlier winters. But nevertheless, I think the burden in terms of severe disease and even just overall people with COVID in the hospitals is much, much less than what we had seen in prior winters. Next slide, please. So this is the case rate trend. Again, this laboratory reported test doesn't include home tests, but I think the trend is still reliable. We peaked there in early December and then have been on a steady decline until really the last week or two. Next slide. And we look at, because we don't have we laboratory reported tests are only a small fraction of overall COVID infections. We look at other metrics. So test positivity similarly has been on a really steady improvement since December. Now down below that 5% threshold. Next slide, please. And our hospitalizations show a very similar pattern. These are daily reported hospitalizations going back to October. We're not quite back to the low levels of the fall. And as I said, there's been actually a bit of an uptick in the last week or so, but certainly not where we were back in December. So these are people anyone who is in the hospital with COVID infection, regardless of whether they're hospitalized for COVID-related illness. California, the state has an approach to use discharge diagnosis records from healthcare facilities to estimate what the burden of COVID disease in hospitalized patients was. And we applied that in Alameda County, looking at hospitalizations in November and December. And about, it ranged from, I think, 47% to 56% in those 2 months were hospitalized with COVID disease. So a little over half, we think, of our COVID hospitalizations are actually people hospitalized with illness due to COVID. Methods are not perfect, but we know that question comes up a lot. Next slide. I mentioned the uptick. This is what I'm talking about. Our wastewater bottomed out in early January during the period of all that wet weather. We might have gotten a bit of an assist there in terms of maybe people staying home a bit more than they would have otherwise. We've had a bit of a rebound in the last couple of weeks. So just going to be watching this carefully. This is also as the XBB 1.5 variant continues to increase here on the West Coast, and maybe that is driving some of this as well. I don't know for certain. Next slide.
Trying to.
So I mentioned that XBB 1.5. So you can see this is a map of COVID variants across the U.S. The distribution is a little bit different on the East Coast than it is here on the West Coast. XBB 1.5 is this sort of purplish blue color on this map. And you can see it's most of the COVID that has been sequenced, at least there in the East Coast, especially the Northeast. Here on the West Coast, it's lagged a bit, still right around half. But it may be that as it sort of continues to take a hold here, that could contribute to a little bit of an uptick. Based on what's happened on the East Coast, if that's what's going on, I'm not expecting a full-on, second winter wave from this. But it's COVID. I try not to predict the future. Next slide. In terms of CDC COVID community levels, which are tied to case rates, but also to hospital admissions, you can see most of the country is in low levels, although the Mid-Atlantic Northeast still a little more active. This has actually been an improvement over recent weeks. And out west, it's pretty calm still. Next slide. Okay, so this is really, I think, what we'll spend some time on tonight. These are table is a brief, very high level summary of some of what's coming up with the end of the state emergency declaration, the various federal declarations, and what we are still expecting to happen with the county local health emergency. I will just say that these are, for most people, for most of their lives, these are not going to have a big effect. Although the federal changes do have some impacts on healthcare, and those impacts are bigger, especially if you're have been enrolled in Medicaid, Medi-Cal during the COVID pandemic. But they are, they certainly are important, and it is beyond the scope of this call to sort of review all of the changes that are going to come with the rollback of these emergency declarations, particularly the federal declarations, because there's just a lot of different policy changes are tied to those. But I tried to sort of pick out some of the most salient points, and we can provide information in the chat for people who want to deeper dive some resources. So starting at the federal level, you may have seen in the news, the plan is for the federal public health emergency to end on May 11th. And the federal disaster declaration will also end at the same on the same day. Those are two different declarations. A lot of changes will happen with that, but a few things that I wanted to highlight. So first of all, there is a program to provide COVID care for uninsured people through Medicaid that will end on May 11th. There are also some additional reimbursements that hospitals get that are tied to this federal emergency declaration that will end. So that's a big issue running in the background. On what used to be tied to the end of the federal emergency, but now is separate, on March 31st, the Medicaid continuous coverage requirement, which what that meant is if you're in Medicaid, Medi-Cal here in California, if you enrolled, let's see, the way it normally works is that you have to have your eligibility status recertified on a regular basis. And all of those recertification procedures were suspended during the pandemic so that people's care wouldn't necessarily be disrupted by that process, especially as they were dealing with all the other disruptions of the pandemic. That's going to end on March 31st. That means that the regular pre-pandemic Medicaid, Medi-Cal in California, Medi-Cal re-enrollment procedures will start. And some people are going to end up losing their Medi-Cal coverage through that process. Now, that won't all happen at once. It's going to happen on a rolling basis, but it is an important thing for people to be aware of. And there are efforts being done. It's statewide by Department of Healthcare Services, and here in Alameda County, it's through the Social Services Agency to try to support people to be ready to re-enroll in their Medi-Cal when that comes up. A few things that aren't going to change on May 11th. So first of all, the medications, vaccines, and tests that are authorized for emergency use by the FDA emergency use authorizations, those are separate. And we don't know when that emergency authority will end. I expect that the FDA is not going to want to stop emergency access to medications that haven't yet received full authorization if they know that they're helpful and effective, which many of these COVID tools are. So we don't know exactly when that emergency use authority is going to go away, but not on May 11th. Also, any medications or vaccines or tests that the federal government has purchased and is making available to the public, that access will continue until those supplies run out. Now, I think that my understanding is that the federal government has not been able to appropriate funds to buy more treatments and vaccines, but there is still plenty of supply. So for the time being, there will continue to be a federal supply of free COVID vaccines and treatments. At the state level, so the governor announced, I think in October, that the state emergency declaration would end on February 28th. The state has actually been rolling back much of the emergency policy waivers and things like that tied to the state emergency declaration for some time. There's only a handful of things left that have to do with who can perform what medical procedures and in what settings and things like that. But there are still some of those are going to get rolled back on February 28th. I think there's a few things that might go to the state legislature for permanent fixes to add some flexibility in terms of the healthcare workforce and who can do, COVID testing and things like that. But the other thing that's happening, we've already seen this with the state, is they are rolling back resources, staffing resources, and testing resources, things like that, that have supported the COVID response across the state. So that has really, I think, picked up a bit in the last couple of months, and is going to continue as part of the end, sort of tied to the end of the state emergency declaration. What's not automatically changing, and what we don't yet know the schedule for, is that there are some state health orders in place still, and those are they don't automatically end with the end of the state emergency declaration. I'm still expecting that we might see most of the remaining state health orders rolled back at the end of the month, but I don't know for sure yet. I haven't heard anything. If you've heard something, please share. One of the big ones is the state requires masks in healthcare facilities. We don't know what's going to happen with that policy yet. Another thing that's important at the state level to note, so there's a lot of changes with the rollback of the federal emergency declaration and changes to sort of Medicare and Medicaid policy. But there are some things that are different at the state level, and it's still a little bit early to get a comprehensive summary of all this. But our understanding is that people who have insurance or Medi-Cal in California will continue to be able to have testing, vaccines, and treatment for COVID covered without cost sharing, even after all of these things get rolled back. That will continue to be the case. If somebody knows otherwise, again, please share. But that's my understanding. For the time being, you can get access to those things even outside of your normal healthcare network. But later this year, you'll have to. It'll be the free testing treatment, or fully covered, I should say, testing, vaccines, and treatment will only be within in your network. And then the other thing I'd add is, we know that just because people have insurance or some kind of health coverage, that doesn't necessarily mean they don't have barriers to access. And we've seen that a lot just with the pandemic. And so there will be plenty of gaps left to be filled. Right now, we still have tests, treatments, and vaccines. Over time, people who are uninsured are really going to be relying, I think, more on the safety net for those services. But we expect, I think, that there is going to be at least some access to those things through various safety net programs indefinitely. And I think we'll learn more in the coming months. So at the local level, we have said for some time now that we will align with the state's timeframe and lift our local health emergency if local conditions permit. Again, we're a slight uptick in the wastewater this week. I'm certainly watching that closely, but otherwise, stepping back and looking at how the whole winter is gone, right now, I don't see that we're going to change that timeline, but again, we really want to make sure at the time that we're getting close to that deadline, that things remain relatively calm. That shouldn't have a huge effect on people in terms of policy, but we are going to make some additional changes at the same time. So we have just a small number of COVID health officer requirements still in place in Alameda County that will roll back at that time. I'd say the broadest and most important of these is our isolation requirement. There's a blanket requirement for people to isolate at home. We are going to transition to recommendations only at that point. There won't be a legal requirement for people to stay home. And then we don't have a legal requirement for quarantine for most people at this point. We still do have a legal requirement for quarantine and corrections. We're going to roll back the legal requirement. We're going to continue to recommend quarantine in that setting, but we're moving with the end of the local health emergency away from the use of the local health officer order legal requirements for these things. There's a few other things that are more narrow in scope and are not as having as much of a, are sort of replaced by state policies that we expect still to remain in place. So I'm not going to cover those today for in the interest of time. I think it's really important to acknowledge here, COVID is not going anywhere, right? And so we want to take the opportunity to step away from the sort of legal mechanisms, the emergency legal tools that we had in place. We've been doing this, as you all know, for really since very early in the pandemic, gradually stepping down the sort of legal restrictions. This is really removing the last few of the sort of emergency legal restrictions and shifting to really a guidelines and recommendations based approach for everything, and focusing mainly on aligning with state and CDC guidance on those last few remaining areas where we might be doing things slightly differently. And then last thing I'll comment on is just that the Board of Supervisors passed an eviction moratorium, as I think you probably all know. And they set that eviction moratorium to expire 60 days after the end of the local health emergency. So that is also affected by this. Next slide, please. So I said this, I'll say it again. The emergencies are ending, but COVID is going to remain a part of our lives. There's nothing, there are no big changes in terms of the risk. The greatest risk will continue for older adults and those with serious health conditions. New variants will emerge that may change the calculus. Our understanding of the short and the long-term impacts of infections is really still growing, and the treatment and vaccination strategies are going to evolve. There's plenty of uncertainty about COVID still. So I think, as we've been through transitions like this before, but this is a big one, but COVID is here to stay, and we're going to continue to be working on it. And I think, living with it in some form or another indefinitely. Next slide. And I think this is nothing new here. I think I'll skip this in the interest of time. Next slide. And I'll turn it to Denai.
Thank you, Dr. Moss. And we have a slight change in the agenda because we wanted to make sure we have plenty of time for questions and discussion. And we have another presenter from our social services agency. And so Donata will catch us all up with all things in the COVID division next time. And so we're going to open it up for a few questions, and then we'll shift over and introduce social services agency for their presentation on Medi-Cal redetermination. And then after their presentation, we'll open it up to full-on Q&A to ask about all the impacts, all the things. Does that sound good for everyone? All right. So what 1 or 2 or 3 questions do folks have right now? Dr. Rhodes, I see your hand.
Hi, thanks. Yeah, I just wanted to get some clarity on some dates because the eviction moratorium, the board has set to expire 60 days after which emergency order is released, at the federal level or at the state level / county level, because county's going to align with state, as far as I understand it.
So my understanding from reading the board resolution that created the eviction moratorium is that it ends 60 days after the local health emergency.
Okay. And then my second question is there any appetite in the department to support a community-led assessment of long COVID? And when I say community-led, what I'm asking, what I mean by that is some of the organizations that we're helping with case investigation and contact tracing already have these lists of people that they were reaching out to. I'm wondering if we could leverage those lists, because then that'll help us actually reach communities of color, because most of these studies are really not focused on communities of color, to understand the impact of long COVID on communities of color. And we have, through the long COVID, the national study, we were going to do a small local study in San Mateo only. So we have a questionnaire developed that's been piloted, and that will go through an IRB process. So it's a questionnaire basically, and I'm just wondering how supportive, or if the county would be at all inclined to participate in that, and by participate I mean give permission for those partners who did case investigation contact tracing to leverage those lists.
I think I'd like to invite Dr. Nielsen, Donata. Would you like to come on? What I'll say, Dr. Rhodes, is that I am very interested in our department partnering with you and community partners to better understand how long COVID is affecting our community here. And I know there are more detailed conversations we'd have to have offline about this, but I will say on behalf of the department, yes, we are interested in looking into how we can partner around this, but I wanted to give Donata an opportunity to speak to that too.
Yeah, I mean, we're definitely interested in long COVID. We actually had a presentation by Dr. Locke today about long COVID. So there's definitely interest. So I'd love to, speak with you offline to see how we can partner on that.
Great, thank you.
Dr. Abalata, welcome.
Good evening. Thank you. Thanks for the opportunity. I have so many questions. I'll just try to limit it to my top one.
Of course you do. Of course you do.
I mean, I share, a little sense of relief around, okay, that was not what we expected it to be far as the winter, wave. But I mean, like COVID has been unpredictable this entire time. So even though this is the first time I remember where our prediction was that it would be worse than what actually happened, we've never quite known the timing of the waves. It's really not quite seasonal. So I guess I'm not fully ready to exhale, I guess. And I'm just wondering if there's anything objective from your perspective that makes you feel like, okay, we're now past the unpredictable pandemic stage. We can now predict like when or how big the waves will be. I think I almost feel like I'm rooting for XBB.1.5 because I'm really nervous about like CH.1.1 and it's, making people sicker. And are we still in that, the variant race, or you feel like we're at a place where it's more predictable?
I don't think it's predictable. I just am reacting to what we're seeing, we're not an immunologically naive population, right? We've had a lot of COVID at this point. I think the CDC published data last week saying, 96% of children had evidence of COVID infection nationally. I think it's 94% in California. So that I don't think disappears no matter what variant we're talking about. But yeah, I think that there's a wide range of possibilities, but there's a wide range of possibilities with influenza as well. And I don't mean to, I mean, you probably, like me, get crazy when people say COVID and the flu are the same, because they're not, and they're still not. But I think it's a useful model when we're talking about uncertainty of the future. You know, we have to move away from some of these emergency designations and some of these sort of emergency tools, because that, I think, uncertainty will probably be with us even after, I don't know for sure. My guess is it'll probably be with us even after we get more predictable sort of seasonal waves of COVID, that there still would be a potential for a concerning variant to arise that causes.
So we're not quite
more
there
fear.
yet, probably. I guess I mean, I think you just made the point that I guess I was trying to ask around, was like, the ending of the emergency declarations is one thing. That's got a lot of factors that go into it. It's not the same thing as saying not the pandemic, because we know the World Health Organization has just said we're still in a public health emergency of international concern. We're still in a pandemic. We're ending these orders because, yeah, we don't want to. I mean, the one that Dr. John brought up was like, you can't keep setting up hospitals in the parking lot. Like, you know, just there's certain things that, and I think we get that. I guess there was a couple points I wanted to make on, you mentioned until they run out or expire. So I mean, I'm saying expire. Actually, you said until they run out, and I'm saying I know that things are going to expire too, and we're seeing a lot of that. And I know like Novavax is all expiring, I think this month, and so I'm just curious if we know about what those how long those supplies are really going to last in their free state. And then also, you know, the coverage of the testing of vaccines and treatment is obviously huge, but as you mentioned, there's barriers. And so I guess I'm wondering if telehealth is protected or is that at risk? And also, you know, whether you'll have to go to your primary care doctor or they cover it like at the pharmacy, like some of the places where people are getting tested or vaccinated now, because I'm not so sure that all the doctor's offices have all of the testing, the vaccine, or they're treating. And so I'm wondering if access to these points of access that have been created from the emergency will remain and maybe could still bill, or will it have to all go to like your primary care? Like, and do we know that part yet?
Before you answer, Nick,
yeah,
I would ask that first, let's make this the last question for this segment. So just document all your other questions, Dr. Abalata.
Okay. No, that was the last one, but I'm putting in a plug for masks in healthcare facilities to continue, even if it's just here in Alameda County, because I think we're doing well here. And I want to thank a lot of people on this call for keeping masks in public spaces, libraries, senior centers, City of Oakland, like go City of Oakland, all the Alameda County public buildings remaining with masks. And I think that we've done a lot of really good things. So I just want to applaud that, but also would say I would be really concerned about removing masks in healthcare facilities, given the unpredictability that you and I have both just stated exists.
I'm going to ask Donata and Nick to try to answer some part of the question in terms of what are we anticipating with the medications and the expirations, and is our health system ready to just, okay, here you go.
Okay, so I'm actually not going to, in the interest of time, I'm not going to try answering it. Dr. Abalata may have seen some of these resources already, but maybe others haven't, and maybe you haven't seen them, Noha, but I'll post some helpful resources in the chat that summarize this. I don't have California specific stuff yet. And then Donata, I don't, you know, feel free to jump in if you have anything to add, but it answers some of the things that you brought up, and I think your larger points are well made.
What I can say from just, you know, conversations with, you know, other, you know, health department or state, that we're all still trying to figure this out. Many of us feel that, you know, it's not quite there yet in terms of, you know, our normal health system just being able to just absorb all of this without a hiccup. And so for that reason, we're trying to, despite the expiration of the emergency declarations and all those other health orders, Alameda County Public Health is trying to maintain a reasonable response to get us through this transition to where, okay, we feel like, okay, things are set. We have answers to a lot of these questions now. And so Donata will be able to speak to that in the coming months, next month and more. And you can, of course, reach out to her offline because she runs our COVID division, and she's the one really working on what stays in place, what goes away, what our new capacities are, how we transition, and how we hold the space and keep doing enough things to not have the whole operation just fall away and we have nothing or very little to replace it at this moment. So, yeah.
Yeah.
I wanted to ask our colleagues from social services, and of course, I know many of you have other questions, and we are going to open it back up to come on. I believe Juan, you'll be presenting for social services.
Good afternoon. Yes, thank you for having me.
All right, you can go ahead and take it away. I think you're running your own slides.
I am. Let me go ahead and share my slides. Hopefully everyone can see that.
Juan, while you are doing that, can you also introduce Anissa?
Yeah, so my name is Juan Vitney. I'm a Medi-Cal program specialist with the Social Services Agency Workforce and Benefits Administration. And also to back me up, I am here with Anissa Basoko Villarreal, one of our assistant agency directors at the Social Services Agency. So I'm here primarily to talk about Medi-Cal redetermination, specifically with the end of the continuous coverage requirement, which Dr. Moss talked about earlier. We will be seeing that the resumption of the requirements coming soon. So just to give a little bit of an overview of what I will be doing today, I will be going over the background of what has been happening over the past 3 years now, as well as going over what's going to happen once we resume processing of the annual redeterminations, and then some of the resources that are available to the community, as well as some of the efforts that Social Services Agency, specifically the Workforce and Benefits Administration, has been, has in the works and has been doing to get the word out there regarding Medi-Cal redeterminations. So first, again, as a high-level overview, since March of 2020, Medi-Cal beneficiaries have remained enrolled in Medi-Cal due to the continuous coverage requirement for Medi-Cal for the duration of the public health emergency. So during the public health emergency, the Department of Healthcare Services, or DHCS, they've been instructing counties to delay processing of.
Hey, Juan, this is Greg Hodge, one of the facilitators. I'm asking you to slow down just a little bit because we've got interpreters, and I know you're feeling rushed because you got a lot to get out there. So just slow down just a little bit. Thanks.
Yeah, so during the public health emergency, again, the Department of Healthcare Services, or DHCS, they instructed counties to delay processing of annual redeterminations for Medi-Cal, or what we call RRRs, until the end of the public health emergency. Along with that instruction to counties, this is also where they instructed counties to delay taking negative action on cases. So a lot of people who may have gotten higher income during the public health emergency, they stayed on Medi-Cal coverage throughout the public health emergency because of that instruction from the state. And so during the public health emergency, to prevent individuals from losing their Medi-Cal coverage because of those renewals, or RRRs, what the system did was automatically pushed out those annual redetermination dates, or those RRR dates, on an annual basis, so that basically everybody's renewal date would get pushed out by a year. However, during this period, some of you may be familiar with the auto renewal process for Medi-Cal, where Medi-Cal beneficiaries continued to be evaluated via what we call the ex parte process, where if we were able to e-verify their information that we have on file, they were automatically renewed for Medi-Cal. So all of that, however, changed when President Biden signed the Consolidated Appropriations Act on December 29 of 2020, December 29, 2022. And with that signing of that, that included the decoupling or separation of the continuous coverage requirement for Medi-Cal from the end of the public health emergency. So as mentioned earlier, the continuous coverage requirement for Medi-Cal is set to end on March 31st of 2023. So this means that SSA, the Social Services Agency, will resume Medi-Cal RR processing actions beginning in April of 2023 for RRs due in June of 2023. And we'll see what that looks like a little bit later. And so subsequently, beneficiaries may start losing their Medi-Cal coverage as of July 1st of this year if they do not complete their renewal or if they are no longer eligible for Medi-Cal. And so again, the continuous coverage requirement is set to end on March 31st of 2023. And so in preparation for the end of that requirement for continuous coverage, the state DHCS has developed an unwinding plan to prepare counties for the resumption of normal processing activities for Medi-Cal. And as part of this plan, counties will have 12 months from the end of the continuous coverage requirement to initiate or start the Medi-Cal renewals for all of our Medi-Cal beneficiaries here in Alameda County. And then we'll have an additional 2 months after that to complete processing the renewals or RRs for these individuals. And so this is kind of just a overview of what it'll look like. So again, the continuous coverage requirement will end on March 31st, which means that the first renewal period for the unwinding period will be between April and June of 2023. So individuals with renewals due in June of 2023 will have the ex parte process started in April of 2023. And if we're able to e-verify their information, then they will be auto-renewed and their renewal date will be pushed out to June of 2024. However, if that is not the case, a paper renewal packet will be sent to them sometime mid-April. What we tell people is the way that it works is that it gets sent anywhere from 75 to 60 days before the end of your renewal month. And so it will get sent most likely in the middle of April. And if there is a due date on those renewal packets, which tells you to submit it sometime in the middle of June, it'll have the exact date there. However, they are able to submit their June renewal up until the end of June. The reason why we provide that earlier due date over there is to give our staff time as well to process those renewals to ensure that they don't lose their coverage at the beginning of July. And so individuals who are not able to complete their renewal for June, or if they're no longer eligible for Medi-Cal, they will start losing their Medi-Cal beginning in July of 2023. And so that will go on, that 3-month process will go on all the way until May of 2024, which is, the total of that 14-month unwinding renewal period. So with that, DHCS requires that individuals maintain their coverage until their next renewal. So individuals won't lose their coverage unless their renewal has been processed. Of course, unless the exception to that is if they meet one of the exemptions, which has been true for the entirety of the continuous coverage requirement. So if someone is deceased, if someone is now living out of state, or if someone voluntarily requests for their Medi-Cal to be terminated, those are the only reasons why they would lose their Medi-Cal prior to their renewal being processed. However, there is a group where, so individuals turning 26, during the unwinding period, their RRs will be pushed to the end of the unwinding period. So with Medi-Cal, there is a young adult expansion, which allows individuals up to age 25 to be eligible for full scope Medi-Cal regardless of their immigration status. And in order for them to not fall off that full scope coverage once they turn 26, their renewals will be deprioritized and processed at the end of the unwinding period in order for it to coincide with the expansion to Medi-Cal of expansion of full scope Medi-Cal, I should say, to individuals between the ages of 26 to 49 in early 2024. I believe it's set for January of 2024. And as part of DHCS's efforts, again, to get the word out there to the community, they have a two-phase strategy, which we at Social Services have been following as well. The first phase was to encourage our beneficiaries to provide updated contact information so that SSA can contact them with important information about keeping their Medi-Cal. The second phase, which we are in right now, as you can see at the bottom of the slides there, it's the 60 days prior to the end of the continuous coverage requirement. The second phase is to encourage beneficiaries, again, to still continue updating their contact information with SSA, report any changes in circumstance with their household, but also, most importantly, to check for the upcoming renewal packets which they may be receiving soon. And just, to add to the continuous coverage unwinding period, we did mention that there may be a lot of individuals that may lose their coverage because they're no longer eligible because they were kept eligible even if they had higher incomes during the continuous coverage requirement. There is a Senate Bill 260, which requires Covered California to automatically enroll qualified individuals transitioning from Medi-Cal into their lowest cost silver plan. Or if the information is already available to Covered California, so in situations where, for example, a beneficiary has been working with SSA and or Covered California to transition to Covered California, if Covered California knows the managed care plan that the individual was in while they were in Medi-Cal, they may be able to switch them over, but under Covered California. And so qualified individuals must be eligible or conditionally eligible for advanced premium tax credits, or APTC, and includes individuals who were receiving Magi Medi-Cal, who have household income increases or family size changes that made their income now above the Magi Medi-Cal limits. This also includes children who have aged out of their aid codes. So for children, the income limit for Medi-Cal is much higher for a lot of them. I believe up to 266% of the federal poverty level. So if they've aged out of those aid codes, then they may now qualify for one of these Covered California plans. Additionally, also beneficiaries not eligible to consumer protection programs, they may also be eligible to be automatically transitioned to that to Covered California. And so what does it look like for SSA and for Alameda County, so specifically for the Workforce and Benefits Administration? So we have an estimated caseload of approximately 265,200 cases with an estimated 476,700 individuals as of December of 2022. The estimate, I believe, on the state level is that 13% of these individuals may lose their Medi-Cal once the continuous coverage requirement is lifted. And that's based on a combination of factors, non-submission of their renewal, them no longer being eligible for Medi-Cal, among other things. That was just the projection that the state, specifically DHCS, had provided to counties. Sorry, moving on. And so with that, in order to kind of mitigate that number of individuals that may lose their Medi-Cal, specifically the individuals that lose their Medi-Cal because of the renewals, of not submitting the renewals, we are working on we always work on updating our public website at Social Services Agency and our social media pages to provide the most up-to-date information regarding the end of the continuous coverage requirement, as well as the unwinding period. It's not on this slide, but also for those interested in statewide information, DHCS has their coverage ambassadors page. If you look up DHCS coverage ambassadors, you are able to sign up for their newsletter, and you'll be sent emails about the latest on the state state level. Additionally, for individuals who want to know when their next renewal is, clients can check our customer automated response system, or CARS. You can do that online through the link that you see on your screen right now, as well as by calling the number on the screen as well. And then and to submit those renewals, we're trying to make it as accessible as possible. So you have the option of submitting it online. You can also submit a renewal telephonically. So you will be on the phone with one of our eligibility staff who will go through an interactive renewal process with you. You are also still able to submit the renewals through fax, or you can also mail the packets to one of our offices, or also submit them in person to one of our offices. And here are our 6 offices where you can do that. For homeless individuals or individuals who do not have a mailing address, they are able to use one of our offices to receive SSA related mail. What I will say about that, though, is we do recommend that they check their mail once a week to make sure that they don't inadvertently lose their coverage, for example, due to a lot of returned mail or mail not picked up. So there may be issues there with the whereabouts unknown and that kind of thing. So we do recommend that they check their mail if they do choose to pick it up from one of our offices. So some of the things that SSA is doing, we have been partnering with 8 CBOs since 2020. Some of them joined us in 2021 to conduct outreach and assist community members with completing Medi-Cal applications and renewals. And so they have also been spreading the message of ensuring that your contact information is up to date with the county, with social services, to ensure that you get all the latest information about your Medi-Cal. So we have the 8 partners that you see on your screen right now: Alameda Health Consortium, East Bay Agency for Children, Family Bridges, Kidango, Korean Community Center of the East Bay, La Familia, Roots Community Health Center, and Ruby's Place. And so, as I mentioned, these CBO partners, who are very valuable and crucial into our outreach messaging at the Social Services Agency, they have been integrating the unwinding messaging in their outreach activities. They've all this time been collecting renewal packets for individuals to make sure that their information is up to date, and sending them over to the county. And they've been assisting also individuals with getting signed up for Medi-Cal in addition to that. And so, as part of that same effort, we also have a marketing campaign that we launched in early of 2022. It was a targeted multimedia marketing campaign that included the creation of the healthyac.org website, which you see a screenshot of right there. There were also online banners, and these were targeted banners, social media posts, e-blasts. There were TV ads, radio ads, streaming ads, print ads, transit shelter posters, and billboards. So that ran for the first 6 months of 2022, and it was relaunched again in August and September of 2022. So with the success that we found with that campaign, we are planning to relaunch that marketing campaign to promote, as you can see, it promotes both Medi-Cal and CalFresh. We're planning to relaunch that soon in 2023, hopefully by March or April. And we're currently exploring ways to incorporate DHCS's unwinding messaging into several components of the campaign. So that includes a lot of the messaging that they have released in the past week. They are also planning on providing additional messaging later this week as well to prepare for the unwinding period. And so part of that is the creation of a flyer specifically about what's going to be happening and to Medi-Cal in the coming months, the return of the renewal requirement. So all of that, that's currently in development, and that will be shared with all of our partners to get the word out there to as many people as possible. Again, to mitigate the number of individuals who could potentially lose their Medi-Cal. And so that pretty much ends my presentation for today. So I'd like to open it to questions again. Thank you for having me today.
Wow. Whew, that's a lot. Thank you, Juan. Thank you so very much for coming, and Anissa for joining Juan. There are questions in the chat, and so Juan, what we're going to do is that we're going to kind of merge a lot of the questions, because people are asking questions about Medi-Cal, people are asking questions about the eviction moratorium. We have colleagues here to answer some questions about the eviction moratorium. And so I'm going to turn it to one of the questions that I saw, earlier question, is the end of the eviction moratorium was mentioned as ending 60 days after the emergency health order is lifted. What measures is the public health department setting to protect our tenants against the eviction crisis that will be caused when the moratorium ends? So we are not in this by ourselves, and we partner with lots of folks around this. And so we've invited our colleague, Michelle Sterrett from Housing and Community Development, to share some of the things that are going on or being planned to address this very thing. Michelle?
Hi, everybody. Thank you for having me. You know, we have had since 2018 an eviction defense program called AC Housing Secure. And that is the organization and the program by which we ran all of the emergency rental assistance funding that the county received. And that covered everywhere other than Berkeley and Oakland and Fremont. So our program was almost countywide, but Oakland received its own grants and Fremont's received its own grants as well. But our AC Housing Secure website, which is still geared towards ERAP, it has other resources available. So all of the legal partners, and I will try and put this in the website, but I'll share see if I can share my screen. All of the legal assistance organizations that we fund are available and can be accessed here. And eventually this website is going to revert to more of a access website and intake. I need help. Here's my problem. There'll be frequently asked questions. As far as getting the word out about when the eviction moratorium ends, we will be doing our best to do outreach and engagement with the community. We'll be relying on other outreach and engagement forums. We'll be reaching out through public health. We'll have some information that's, you know, a one-pager that is in multiple languages that can get out the door. But in reality, if you are being asked to move out of your home, you do have some protections. And for instance, if you're in Oakland and Berkeley and Alameda, you are covered by Just Cause for all types of housing units. If you are living anywhere else in the county, you are covered by Just Cause if you live in multifamily housing. If you are renting a single family home, a condo, or a townhome, those same protections that the state provides don't cover your unit. And so in that situation, you would definitely want to reach out to our legal defense teams here at these organizations to help you navigate what to do next. My team is available to help as well, and you can reach out to us through this website here, or you can email me at Michelle. I'll put my email address in the chat. Michelle.stare@acgov.org.
Thank you, Michelle. I think this question is for you, Juan, and a little bit you, Michelle, and our colleague Carrie Abbott from Homeless Care and Coordination had to jump off, but it's related to residents who are unhoused. Gary asks, how many people will not be notified due to the housing moratorium expiration and or other unforeseen reasons? These policies are only impacting communities of color who can least afford the impact of like lack of coverage. And so, Juan, how is SSA planning to, given that there are people who are unhoused now and people who will possibly be losing housing, how is SSA going, and losing Medicaid all at the same time potentially? What measures are you all taking to bridge that gap with people who are currently unhoused and or potentially unhoused?
Yes, thank you. So that's a very good question, and really a big part of why the outreach, the partnership with our community partners even started, was to conduct these outreach activities to the most vulnerable communities in the county, the hard to reach individuals, which includes obviously the homeless population, and as you mentioned, those people who will be possibly unhoused soon. And so that is primarily, how we're trying to get the word out there. Again, we have been trying to be proactive with it. As early as mid 2022, we have already been promoting the word to make sure that you update your contact information. And if you don't have a primary mailing address to set up for your mail to be delivered to one of our offices, or if you are working with one of our CBO partners that they're able to be your authorized representative, they can receive mail on your behalf as well. So those are just some of the ways that we've been trying to get the word out there for over half a year now, to make sure that most people have the information. Obviously, it's still an ongoing effort, and our CBO partners are still continuing to spread that word. And a big part of our target populations for those outreach efforts, specifically with the 8 community partners that I mentioned earlier, is for the homeless population.
What I also wanted to add, thank you, Juan, is that our Office of Homeless Care and Coordination is also partnering with SSA, and we are, the team is engaged in working, getting their staff, outreach and shelter providers trained in helping people with Medi-Cal applications, research process, to educate people, to let them know. And so it's really, this is an all hands on deck. And so the reason why we wanted Juan and Anissa and Michelle to come to this space is that you all who've been coming to this meeting and hanging with us, month after month, are working in the communities that we're talking about, and you are those liaisons. And so we also know that we rely heavily on all of you to help let people know. And so there's information being dropped in the chat. Please note the information so that you can also start sharing this information in your communities. Now I'm going to take some hands.
Melvin Cowan has been up for a long time. Yeah.
Yes. Thank you, Melvin.
Yes, good evening, everyone. My name is Melvin Cowan with BOSS, and I really appreciate Juan's presentation, as well as Michelle. And my question for Juan is, so there, I think starting in January for SSA, COLA increases were initiated. I think it's like 8.7% or something like that. My wonder is, for those who have, so for beneficiaries, what impacts are they likely to see as a result of the the COLA increases for SSA beneficiaries in terms of like, medical rates? Are they likely to increase? Because I did learn that the SNAP benefits are likely to be reduced for those individuals. So just curious about your thoughts on that.
So yeah, with the COLA increases, Medi-Cal itself also has COLA increases. Again, primarily Medi-Cal coverage, especially with the MAGI group, it is based on the federal poverty level. So it stays at the same percentage for most individuals, most adults, I should say. It is at 138%. So that does get taken into account every year in determining eligibility for Medi-Cal.
And so for beneficiaries, are they likely to see any decrease in like cash on hand, or are they likely to be okay?
I'm sorry, I'm not sure I understand the question. Could you clarify what you mean by cash on hand? Sorry.
Yeah, and I'm sorry about that, Juan. I'm on the road. So I'm just wondering with the changes that are happening, so for those that may need to go for like medical treatment, are they likely to see like increased rates, like as a result? And so if that's not the case and they're going to be fine, then that's okay. I'm just trying to see what are the likely impacts.
I unfortunately don't have information on that right now, but I'd be happy to take it back.
Sure thing. Thank you.
There was another question in the chat, and I do see you, Gary. But I wanted to get this other question that was about CalFresh. It says, will the CalFresh benefit be reduced also, and when?
So with the CalFresh, apologies, I'm not the expert on CalFresh, but I believe so they had those additional allotments that have been provided on a monthly basis with the passing of the Consolidated Appropriations Act of 2023. That is also coming to an end. I believe the last month for that is February, with the issuance showing up on EBT cards in March. So as a consequence, there will be some type of negative impact for all individuals because they will be losing that supplementary issuance.
Thank you. Gary Blodger.
Thank you. So Juan, I'm really quite concerned. I think you had mentioned, Juan, that there was a 13% acceptable rate of individuals falling off of the rosters, 13%. And you had mentioned somewhere in the vicinity of 500,000. So you're saying 50,000 plus people are going to fall off the ranks, and we're accepting that as being a positive impact. First and foremost, what I'd like to also have considered is that all of these systems are coming to a conclusion and merging roughly around the same time. When we have the housing moratorium, when we have all of the federal, state, and local mandates coming to an end with regards to COVID, et cetera, all of these things are coming to it and ahead at around the same time. And then when we look at the capacity of the system to be able to have people navigate all of these systems at one time, do we have, first and foremost, the capacity within the public health department to ensure that Alameda County residents alone, let alone those outside of the county, can be able to afford to have access to these services? And I'm just thinking back to when people were giving the opportunity to have their rent paid, and those people were in their portals and stayed for indefinite periods of time, and still to this day have not been serviced. I can see that, yet again, rearing its ugly head in many ways and for many services. And I just don't see all of this, coming at one point in time and being able to, put our communities in a position where they are afforded the availability of access to the services in a timely manner, not falling off the ranks and, not having their housing taken away, not having their Medi-Cal taken away, et cetera. And then having a pandemic, rear its ugly head in hindsight, right? What do we do?
Yeah. Thank you for that. So Gary, we are all concerned that, it was tough enough putting all these things in place at the beginning of the pandemic. And I don't know that we all predicted how it would all converge, the unwinding of all these things and the impacts. But I think what I heard Juan say was that 13% is not, we are not calling that acceptable. He did not say that. He said that the state is predicting that about 13% will fall off for a variety of reasons. What I also heard is that some of it will be because a person is no longer eligible. I don't know what portion of the 13% that is, but then let's say if the rest of the group are still eligible, that's where we all come in. Because if they are still eligible, then it really is about us getting the word out and helping people to get their information updated, get their information submitted again, to ensure that in Alameda County, whatever portion is 13 of that 13% are people who will fall through the cracks, that they don't fall through the cracks, that it's not 13% here. If you're not eligible, that's a different thing. Any longer you make more money or whatever, that's a whole different matter. But I think that's what I want us to walk out of here with, that we can help be part of the solution because we can help to get the word out and we can partner with SSA to do that. We have 3 minutes, but we have a question from Dr. Demisha Burns here in the chat. How are other community agencies, I'm abbreviating, sorry, Dr. Burns, how are other community agencies, workers able to join this effort to ensure that this is being communicated with those populations areas potentially not covered by one of the current community partners that you listed? So that's for you, Juan, that there are CBOs that you named. Are there other ways that other CBOs can participate?
And I can jump in here too, Juan, too, in terms of just overall from community partners. We do have what's called an e-publication where we share information with all our community partners. I would encourage you to put your name in, or if you want to send me your email, we'll make sure you're part of our distribution list. We can share the materials that you could definitely share out with your networks. We encourage you to share as much information as you can, as often and as widely as you can. And in terms of, Mr. Blodger, to respond to you earlier too, you're right. It is the trifecta of things that are happening all at once, right? In terms of the unwinding. And that's why our agency is really working towards, as many avenues as possible to try to get the information to our communities. They can do it on the website, online, they can come in person, they can work with community partners. We have, they have the capability of coming to our on-site and uploading their own materials without actually talking to someone. So there's a variety of different ways that people can upload their information, update their information. And we are definitely all hands on deck, and we would encourage you to be a part of the solution with us.
All right. Thank you. And I think we caught all the questions that were in the chat, but I know there will be more questions that you all will think of. I want to first thank all of our speakers. Thank you, Dr. Moss. Thank you, Juan. Thank you, Anissa. Thank you, Michelle, for being on standby here, answering questions. As these questions continue to come up, please share them. We will try to make that connection with our partners at HCD or with SSA so that we can really help our community. And the more we all know, the more they will know. That is a critical part of how we've been able to do as well as we've done in this county throughout this pandemic. So thank you all for adjusting to the 7th. I know this was a big change, but we wanted to keep open for those of you who want to, do something on Valentine's. Now we want to keep that day open for folks. So we will see you all next month and have a wonderful evening. I think, Greg, please tell me, am I missing anything else on our agenda?
No, you hit it all just right. We're right at 7 o'clock. Have a good rest of your week, and we will see you all the next time. And thank everyone for doing the hard work that you're doing to keep us healthy and safe. All right, we'll see you next time. Bye.
Hi, Kimmy. Thanks for inviting us.
Thank you, Anissa.
Awesome. Thanks, Lauren. Good to see you, Donata.
Hey, Kimmy. I never get to see you except for here.
She's
Hi and bye. She's
disappeared.
gone. Anyway, thanks, you guys.
Thanks, Dr. Rhodes.
Yeah.